The South African Medical Association is hosting its annual conference, which is looking at all weaknesses as well as the strengths of the healthcare system. This is over the next 3 days. The conference is being held in Sandton, Johannesburg. SABC News Senior Reporter Hasina Gori was in conversation with SAMA chairperson Dr. Mvuyisi Mzukwa.
For the first time since the COVID-19 pandemic, the South African Medical Association has hosted a conference in person. This year's theme is in strengthening the healthcare system as we come out of that global pandemic which affected many South Africans' lives. Also, the healthcare system as well is still coming to grips with what they battled during that time. This is a conference bringing together like-minded people ahead of the new year, but also with many new strategies and policies that are coming into fore. The National Health Insurance Bill being one that is in the top of the agenda, both politically but also affecting those in the healthcare system. I want to bring into the conversation SAMA's chairperson. Thank you so much, Doctor, for speaking to us. Let's start with the conference that we are today. Just opened, going to be happening for the next 3 days. What's the aim of this year's conference, and what does it hope to achieve?
Thank you so much for having us. As you have noted, the theme of the conference is towards strengthening the healthcare system. We know that we're coming out of the pandemic. We know what it has done to our healthcare system, but also we know that we've got systemic challenges, that need to be addressed, not only by government but by all stakeholders, including the South African Medical Association. We are an affiliate of the World Medical Association. We are the largest association in the country. So we do need to deal with issues that are affecting the healthcare system. So we are going to be talking to issues that are a solution to our problems, and we are going to follow up on the resolutions of the conference.
Before we go forward into the future, I want to look back and into COVID-19. What are some of the lessons that the healthcare industry will take when they look at dealing with the healthcare system as a whole?
It was clear that our healthcare system was not ready for the pandemic, even though we were told by politicians many times that our system is ready. It proved them wrong, that actually our system really needs a reform. We know that there's shortages of healthcare workers, and this was made clear. It became prominent at the time when we had a pandemic. You know that we've got about 0.35 doctors per 1,000 citizens in the public sector, and also 1.75 doctors per 1,000 citizens for the private sector. Now, if you look at those issues, you can actually see that our system was not ready, and still not ready if you look at what we have at the moment. But also, the other thing that showed up was the issue of leadership and governance. We had serious problems of leadership and governance. We need to tighten up on that. We also need to tighten up on issues of corruption. It should be clear to all South Africans that you can't be allowing corruption in the healthcare. It should be a holy place. Healthcare should be a holy place. No amount of corruption should be tolerated in healthcare.
You highlighted that there's a shortage of health professionals in the sector. What are some of the challenges that are underpinning that shortage?
We are told by the government that they do not have money to employ healthcare workers. But also we've noted that Treasury is not assisting because there's been a drop in the budget of about 1% over the years. So obviously, if you look at those dynamics, it tells you that we are going down. But you look also at the pandemic itself. We lost so many of our healthcare workers, and what provinces have been doing is, instead of re-employing, they've been freezing those posts and even erasing those posts. So that is what we're having at the moment, challenges of dire shortages of healthcare workers.
The governing party is pushing forward with the NHI, the National Health Insurance Bill, and SAMA has its objections to the current form of the bill. Can you expand on that objection that SAMA has?
We've got so many objections that we've raised. First of all, we're of the view that the system itself is not ready for the NHI. I've highlighted earlier on, issues of leadership and governance, all the pillars of the healthcare system as envisaged by the World Health Organization. We support basically the objectives of the bill, but we are saying that you need to attend to other pillars as well, including our dilapidating infrastructure, our unavailability of medicines, broken equipment in the hospitals, and all those challenges as well, even power outages in the hospitals. So those are the issues that we were saying. If you are going to be reforming a system, you can't be just focusing on one aspect of it, that is finance. You should be looking at reforming the whole system, so that it gives this quality healthcare system, delivery that we're talking about. So the other thing is regarding asylum seekers. This bill says asylum seekers will only be seen if they present themselves in an emergency. But it's a very illogical approach to it, because if you have somebody who does not have an emergency, who's got things like TB, who's having a cough, as long as that person is not having shortness of breath, you can't treat that person. So you'd be spreading this TB, to all South Africans, and then you wait for this person. And when the person presents to the healthcare system, you put them in ICU, the most expensive resource in the country. So it does not make sense to us to say that you are going to wait until they have emergencies. It does not make any financial sense.